Hi, so today we'll be talking about psychoactive drugs. What is a psychoactive drug? It's a chemical substance that alters perceptions, mood, thinking, and behavior. Sometimes it can be also called recreational drugs. It may be used for some medical uses as your health or stuff like that. Dependence and addiction. Dependence is relying on something, such as coffee every day. Addiction is living in the spine of a neck, even though it might be negative. Also, like these pictures with these drugs. Dependence can be physical or psychological. Addictions involves intense cravings and loss of control. Both can have serious impacts and or health and well-being. Thanks.
Tolerance is the continued use of psychoactive drugs. With the repeated exposure to a drug, the drug's effect lessens, thus it takes bigger doses to get the desired effect. Withdrawal. Upon taking a drug after addiction, users may experience undesirable effects of withdrawal. Substance use disorder is a treatable mental illness that gives you, like it affects the person's brain on being able to control their substances, much like illegal or legal drugs, prescribed drugs, or alcohol and other things such as that. Ecstasy is a synthetic drug that alters moods and behaviors just like hallucinogens, and it produces like an increased feeling of being more like having more energy or being more emotional and stuff.
Hallucinogens, they are a psychedelic drug that distorts perceptions and evokes sensory images in the absence of sensory input. LSD. LSD is a type of drug that causes hallucination, and it is known as one of the most powerful drugs. The trip usually lasts 16 to 14 hours. Marijuana, drug that produces feeling of elation and promotes relaxation. It also relieves anxiety and increases sensitivity to sight.
Stimulants are a class of drugs that speed up messages traveling between the brain and the body. The prescription stimulants increase alertness, attention, and energy. If you misuse them, it can include an overdose, lead to psychosis, anger, paranoia, hard nerves, and stomach problems. And if you do nicotine, it is found in stimulant. Certain plants, and most notably tobacco, e-cigarettes cause irritation, burning sensations in the mouth, throat, and increased elevation, nausea, abdominal pain, vomiting, and diarrhea.
Cocaine. Cocaine is a powerfully addictive drug. Cocaine can be used for many different purposes, one being medical purposes. Normally, dopamine recycles back into the cell that releases it, shutting off the signal between the nerve cells. However, cocaine prevents dopamine from being recycled, causing large amounts to build up in the space between two nerve cells, stopping their normal communication. Methamphetamine is a stimulant drug, usually a white bitter tasting powder or a pill. Crystal methamphetamine is a form of drug that looks like glass fragments or shiny bluish white rocks. This drug increases the amount of natural chemical dopamine in the brain. Dopamine is involved in the body movement, motivation, and reinforcement of rewarding behaviors. The drug's ability to rapidly release high levels of dopamine is reward areas of the brain strongly reinforces drug-seeking behavior, making the user want to repeat the experience.
Depressants Depressants are a kind of drug that, when exactly as prescribed by a doctor, can relax your muscle nerves, but it can also be used poorly, and if it is used poorly, it sometimes can cause confusion, lack of coordination, shaking, slurred speech, trouble concentrating, and sleepiness if taken too much, and if not diagnosed by your doctor. Alcohol is a substance in your brain that affects your chemical balance. If ingested, it can affect your mood, feelings, and behavior, both positively and negatively.
A few moments later.
Barbiturates are medications that cause you to relax or feel drowsy. They also stop or prevent convulsions or seizures. They affect your brain by increasing brain chemicals, which slow down the activity of your brain cells. And if abusing these drugs, you get hallucinations, high temperatures, and seizures. And opiates are powerful substances related to chemicals found in opium poppy plant. Some opioids are used medically to relieve pain. They're highly addictive. Using these 3 to 5 times can cause you to become addicted. And if abused, many things can happen, such as vomiting, limp body, pale or blue skin, or cold skin.
So biological influences, so some biological factors that can affect a person's risk of addiction include the gene stage of development, also gender and ethnicity. Children who are acceptable, impulsive and fearless, traits which are genetically influenced, they tend to be more likely to smoke, drink, and use drugs as teens.
Psychological and social cultural influence. For psychological, some people feel like their life is meaningless and turn to drugs and alcohol as a solution. Drugs and alcohol give a euphoric high or give them a sense of self-control or a chance to dull the pain. It could also be a way to cope with anger, anxiety, and insomnia. Social cultural influences could be drugs are used as social drugs, so like to see friends and stuff. Most teen drinking or drug use is done for social reasons, not as a way to cope with problems. And then peer pressure and influence is a heavily factor in people's initial drug use.